to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education.
Hello, good evening. Good evening, everyone. I hope you are well. Frida, kindly confirm whether I'm audible.
Yes, we can hear you.
Okay, thank you. So, welcome to today's health access session. This is the fourth session of our cycle 4. So, in today's session, we will discuss about Actuate health risk pooling. It is during the summit, we will have a series of health access hackathons. This way, people will compete to come up with innovative solutions using smart contracts to because in our previous classes, we have realized that there are challenges, gaps exist in health access in healthcare delivery. So we will learn all this. And before we start the discussion, allow me to take you through the meeting agenda. We will start by topic presentation by our topic master, who is Ronald Anthony. Thereafter, we will have running. We will have to hear from our CEO further remarks about the topic, and then we will have an interactive session where members can ask questions and give their opinions about the topic and raise any concern. And after that, we will have summit announcement by Augustine Narokwe, and then we will conclude the meeting. So allow me to welcome our topic master, Ronald. Hello, Ronald, can you hear me?
Thank you. Good evening, everyone. I'm Ronald Anthony. It's a privilege to be here today to discuss a topic at the intersection of health, technology, and financial security. Actuate health risk pooling smart contract. This innovation represents a significant leap forward in how we manage healthcare, leveraging the power of blockchain and smart contracts to create a more transparent, secure, and efficient system for sharing health-related financial risks. At its core, health risk pooling is a concept many of us are familiar with. It's the idea that by coming together as a group, we can spread the financial burden of medical expenses. Instead of each person bearing the full cost of unforeseen health issues, contributions are pooled to provide coverage for all. This principle has long been the foundation of traditional insurance models. However, as we know, traditional models are not without their challenges: complex administration, high costs, delay in claim processing, and often a lack of transparency. Actuate's approach addresses these very challenges by utilizing blockchain technology and smart contracts. Through this system, we can automate the process of risk pooling in healthcare, offering a solution that is faster, more efficient, and far more transparent than traditional methods. Let me walk you through how this works. How Actuate health risk pooling smart contracts operate. This system begins with contribution. Each participant contributes an agreed amount to a shared pool of funds. Unlike in conventional models, these contributions and all subsequent transactions are recorded on the blockchain, ensuring transparency at every step. Every dollar contributed is traceable, offering complete visibility to all participants. But it doesn't stop there. The smart contract is embedded with predefined rules that automatically process claims. When a participant incurs a medical expense, they submit a claim through the contract. The smart contract verifies the claim based on established criteria, and if all conditions are met, it releases funds from the pool to cover the medical costs. This eliminates the need for third-party administrators, reducing administrative costs and delays in payout. This system also adds a layer of security that traditional models cannot match. Because the blockchain is decentralized and tamper-proof, the risk of fraud or manipulation is significantly reduced. Participants can trust that their funds are safe and will be used as intended without interference or biasness. The benefits of Actuate solution. Now let's talk about the benefits. One of the standout features of Actuate smart contracts is the automation of the entire process. With claims being processed automatically, the administrative burden is dramatically reduced. making the system cost efficient and accessible to a broader audience, particularly in regions that struggle with expensive or inaccessible healthcare. Another key benefit is fairness. All participants, regardless of their background, are subject to the same rules encoded into the smart contract. This ensures that claims are processed fairly and without the risk of human error or bias. In a world where trust in systems is often in short supply, this level of fairness is crucial. Moreover, this approach has global potential. Imagine communities in underserved regions where access to traditional insurance is limited or non-existent, coming together to form their own health risk pools. Through a smartphone, they could access a transparent and affordable solution, sharing risk and ensuring that no one is left behind when it comes to healthcare. Potential challenges. Of course, no system is without its challenges. One of the most pressing issues is data privacy. We are dealing with sensitive health information, and ensuring that this data is secure, handled on a public blockchain, is a challenge we are actively addressing through technologies like zero knowledge proofs. Another challenge is regulation. The legal landscape around blockchain technology, particularly in health insurance, is still evolving. Actuate is working diligently to ensure compliance with the laws of various regions, but these will require ongoing efforts. Looking to the future, looking ahead, the potential of AI and decentralized finance integration could further enhance Actuate health risk pooling contracts. Imagine using AI personalized risk assessment or applying decentralized finance to create even more flexible community-driven funding models. The possibility of vast, and we are only scratching the future. In closing, I want to emphasize that Actuate health risk pooling smart contracts are more than just a technological innovation. They are a new way of thinking about healthcare, a way that empowers individuals, fosters transparency, and makes healthcare more accessible and fair for everyone, particularly those who need it most. Thank you for your attention, and I look forward to seeing how we can work together to make healthcare more equitable through the power of technology. That's the end of my presentation.
Thank you, Anthony, for that insightful presentation. Now I will welcome Dr. Mashari, our CEO, to give us further remarks about the topic. Doctor, you're welcome.
Okay, Glory, confirm you can hear me. Hi, Glory, can you hear me?
Yes, Doctor, we can hear you.
Okay, wow. Yeah, thank you so much, Ronald Anthony. Always, he's known as Professor Anthony. Anthony is very smart. Now, smart contracts for health insurance, the health insurance on the blockchain. Insurance industry is the most difficult. It's let's say punishing because when the insurance started, particularly in healthcare, in the US, it started with teachers, something they call the Blue Cross or the Blue Shield. Yeah, Blue Shield began in Texas. Teachers, because they were not having so much money, and they would go to hospital and get kicked out, so they got together and started doing Mushango. Yeah, the chama, it was just a local chama, Blue Cross. Initially it's blue shield. That means shielding against diseases, so it was blue. And then it was adopted by the people in the faith-based organizations like Catholic Church. became Blue Cross. So we have now, then later they merged to become Blue Cross and Blue Shield. That was in 1920s. Before that, you see, that was the Great Depression in the United States. There was a Great Depression in 1929. Economic depression. People could not afford anything, including healthcare. So later on, the Blue Cross Blue Shield merged together over the years. Now they are very huge organizations. And then those days, there was no coverage from the government because healthcare was considered something very private or personal. It was all private. So the teachers started this. And I believe even healthcare on the blockchain, risk pools may start with teachers. So we need to talk to teachers unions. Yeah, because teachers have got access to families and they mobilize people in the United States in a big way. Now, the way the insurance then evolved was like you pay the principal every month. That's the money you pay into the system, so that when you get sick, you go to the hospital, they are going to pay when there is a claim. So the hospital or the provider will process a claim and then they get paid, and then the provider gets paid. So there was you as the contributor to the Blue Cross, and then there's the Blue Cross itself that keeps the money and waits for you. If you get sick, then it's going to pay for your healthcare services at every encounter. Then they merged something else when that happened. People called providers. Providers, in the beginning, it was quite fine. Everybody was honorable. If you go to the doctor, they see you, because we didn't all have this medical technology. Let's say if you're coughing, they're going to give you treatment for cough. If you're having stomachache, they'll treat you for stomachache. But see, that was in 1930s. Then Second World War comes. Then 1940s, after Second World War, there is population boom, the baby boomers. Because then in 1950s, there were so many children, so many babies. At the same time, the war ended, and the war technology itself, the technology that was used in the Second World War, has nowhere to go. So of course, people in tech, scientists, of course, they use that war technology to create medical solutions. For example, the ultrasound itself, ultrasonography was developed for detecting submarines. Now the ultrasound we use for detecting a small baby that's growing in the uterus of a mother. It was used for detecting submarine inside the ocean. But after the Second World War, that ultrasonography technology had no use until they said, oops, now we can use it for detecting, baby in the pregnant woman. So all of a sudden, everybody's going for an ultrasonography. And then they have to employ ultrasonography technicians. That means it becomes expensive. So people have to pay, the insurance company ends up paying more money. And all these other technologies, for example, they develop medications initially for protecting soldiers against tropical diseases like malaria, like tuberculosis. They even figured out penicillin. Of course, penicillin was invented because before that, in the 1930s, there was no penicillin, by the way. So penicillin, then you had gentamicin, all these new antibiotics came around 1950s, 1960s, 1970s. And now everybody's using them, anti-malarial tablets like malaria queens. So medical technology, biological technologies, because of all the knowledge they have gained in science, the science to fund the war, is to including nuclear medicine. Of course, they made an atomic bomb also. So all that knowledge in nuclear even nuclear became nuclear medicine that you use for diagnosis and therapy, treatment, and even radio pharmacy, radio pharmaceuticals. So, and then there was pharmaceutical development. So, as all these things are happening, you see the cost of care continues to rise. That the premium you paid is not even enough to pay for your medical care, because when you go to the hospital, then doctors have gone ballistic. They are using all these new technologies, new antibiotics, new tests, X-rays, CT scan. Can you imagine all these things? Now the hospital became like this giant supermarket where you admit as a patient, and then the people in the hospital will do everything to do all the kinds of tests so they get paid by the insurance company. So I can tell you that was super crazy, because when this thing began, it was just a local chama. And the local chama was not exposed to all these new technologies. And then, of course, the doctors with their extreme enthusiasm and zeal to use these new technologies, but somebody has to pay. Who pays? The insurance company. And that was very, very hard. It became so severe that some companies that were forming for health insurance, say after Blue Cross, they had to shut down because it was too expensive, or they increased the premium. And the more they increase the premium, the more the hospitals charge, and the more the doctors charge for their services. In fact, many people in the healthcare industry became very, very crooked. Like, you could come to see a doctor, and then he would ask, he would actually make so many diagnoses for you. He's going to get paid, because how does the insurance company know what the doctor is charging? So it became like a blank check, where the people in the healthcare industry, particularly the most crooked ones, could just get paid for not doing anything, or even sometimes inventing, just adding extra tests or adding extra procedures to claim they have done a procedure for you, and then they claim the money from the insurance industry. It was a disaster. So that also, of course, the insurance companies, the way now to deal with that was now to employ people to verify that what the doctors are billing is actually what was done for the patient, or even whether it was actually necessary. For example, they developed this language called the medical necessity. So the claim process becomes complicated. Now they had to employ a whole new department and then they have to even employ doctors to watch whether what other doctors that are setting claims are actually, those claims have got medical necessity. See? And it is very, very hard. How can you prove that somebody did not need an X-ray? How can you prove that somebody did not need an ultrasound? How can you prove that somebody did not need this new second line antibiotic? You see, it's very difficult, because you're challenging the opinion of another doctor. It's just an opinion. That's called a doctor's opinion. So challenging medical opinion, it's difficult. And so what the insurance companies have to do is continue increasing the premiums, so that now if you are paying $100, say $10 a month, in a very short time it came close to $50, and then even $100 every month for insurance. That was hard. But that has not stopped. So because people always, so long as the insurance companies, people always find a way of trying to get money from those insurance companies. And then insurance companies are busy trying not to pay. Now, we have inherited this type of system in Kenya. So when you go to say you have an insurance coverage, and then you get admitted to a hospital, say like Kenyatta Hospital or Nairobi Hospital, the the hospital will take a long time to verify that you've got insurance, and the insurance is going to be willing to pay. The people at the hospital will not admit you to the hospital until they have the green light from the insurance company, or you can admit that one. Yeah. And this came because of this contention that came out between the insurance companies and the providers. And then you are the patient, or you are the person there left in the middle. Now, that party that emerged from the Blue Cross going forward is known as the third party system. Third party. You see, you are third party yourself. They don't care about you, although they make you pay. But when you get sick, you are third party. You are not involved in the decision. So the hospital say, Nairobi hospital say, this is how much we charge. And then the insurance is going to say, no, we are not going to pay you that money. And they're never going to ask you, by the way. They won't ask you, okay, Mr. So-and-so, okay, Anthony, your insurance company. So then even then the hospital itself can submit claims to the insurance company, having done things, and the insurance company will say, oh, those things were not needed. There was no medical necessity. Because what insurance company has done is to employ medical professionals to be verifying transactions. Can you imagine that? Now, if you're receiving transactions from all the hospitals, and then you're supposed to be second guessing, why did the doctors do this? So it is very, very tough. And it's payment, and this is just because. Oh, Veronica, you need to, you need. So this is just because of that third party system, but that's happening in the centralized finance system. And even then, not everybody can participate in that, because it requires for you to participate in, say, that type of insurance, you have to have a steady source of income, you have to be employed, and you have to be paying premiums every month. If you don't pay, let me tell you, you can be paying premiums for the last 1 year, and then you get into some financial difficulties, like you lose your job, and then you stop paying, and they are going to discount all the money you paid. You lose it. Yeah, you lose all that money. So there's no historic say, oh, this one has been a good customer, has been paying very well. So, and now they don't have a job. This person doesn't have a job. Let us keep him on the plan. No, they're going to cancel your plan very fast because you're not paying premiums. So it became a very dirty game. It's the traditional insurance. And yet it covers on, say, for example, in Kenya, the people covered by traditional insurance are less than 3% of the working population, the adult population. The rest of them are supposedly covered by National Hospital Insurance Fund, which has been, of course, dismantled by this new government. And now we have social health insurance, which is just a joke. And so there is no coverage. And even then, the social health insurance or National Health Insurance Fund presupposes that you have money to pay their monthly premium of about 500 shillings a month. But where do you get that money if you do not have a job? And even how do they know you if you are not in the system? For example, if you are a local subsistence farmer, producer out there in the village, if you have a chicken, you make money, or you raise cows, but you're not in the system. So contributing to either social health insurance fund or national health insurance fund is supposed to be voluntary. Okay, it's supposed to be voluntary. Because there's no law that says if you don't contribute, you are not in our country. The problem with that is that occurrence of disease, the likelihood of falling sick is not voluntary. It has nothing to do with your will. You can get sick anytime. You can require medical services anytime. So there's a huge problem to think that the voluntary participation in contributions to the monthly premium is going to be congruent with the involuntary or spontaneous likelihood of occurrence of disease, which is random. And that is the problem right there. And that's why now this National Health Insurance Fund and social health insurance do not cover many people because it's voluntary. But here we have now technology that is decentralized, that takes care of that problem of randomness, because the technology, decentralized finance, like the Actuate token, the way it operates, it built on mathematics of randomness, which completely aligns with the likelihood of occurrence of disease. And we don't have to ask people to pay premium to participate in these health risk pools. This premium, the money, the fund for which we now collect for the insurance would come from every moment to moment transaction. Like if you send Actuate tokens to me through your wallet, Actuate token will be able to share for a little bit of Actuate, some liquidity, like 0.01% of that, and set it aside. So it looks like a transaction fee. That's in addition to the transaction fee, which you already pay. It's called the gas. So we put that gas inside a liquidity pool. And that is where we build the payment fund. Now, if we do that and we leave it at that point, that we can collect money from every transaction, such that when you go to the hospital or you go to see your provider, you only need to flash your QR code. And then when you flash your QR code, the provider is going to see you, and the provider gets paid also through that QR code. But then we can have the same problem that occurred in the United States, where people can now start charging for anything they want. You see, to pretend that things that we'll talk about medical necessity. I think that's the thing that we would have to figure out completely, and that's why I like that we have artificial intelligence. That AI is like to help us. We build this with AI. It's to help us to establish medical necessity. And I'm saying this thing in all its seriousness. One, for example, making diagnosis of patients, we have said it's a very high, it's called informed guesswork, educated guesses. Because you listen to the patient and then you say, it could be like this. Then you come up with something called differential diagnosis. Differential diagnosis is what you suspect. It's called suspicion. What you suspect could be bothering the patient. And then you do tests to confirm or to eliminate that diagnosis. See, usually if you ask medical students, even doctors in practice, when they listen to a patient, they come out for the new ones who are coming training, they come without 10 differential diagnoses. 10 differential diagnoses. That means that any one of these 10 diagnoses could explain the disease process happening to the patient. If you have 10 differential diagnoses, is that you have to eliminate 9 of them to remain with 1. The process of eliminating those differential diagnoses is known as medical tests. You do tests. You send the patient for X-ray. You send the patient for laboratory tests, for chemistry, chemical analysis. You send them for all kinds of tests. You send them for MRI. Now, if you have artificial intelligence, it is possible to use AI, because AI is much more intelligent than all of us, to enter the history of the patient, and you enter the history of prevailing illness, all the symptoms, and then you ask the AI program to give you the likely diagnosis. And you see, the people have tested AI here in the United States to see the accuracy the accuracy of AI in terms of diagnosis. And AI is accurate more than 93% of the physicians, per sector. It is very smart. It's of course, AI is smarter than most people. And so if you have 3 doctors and you ask them about the same set of symptoms, what they think they're going to come with so many differential diagnoses. But the AI, if you ask AI programs, a lot of those, they are going to come up with very, very narrowed down diagnosis, very, very accurate. So what's that? First of all, AI helps to eradicate the huge list of differential diagnoses that people come up with, and then they try to confirm that diagnosis with test. Now, if the AI can give you a very pointed differential, maybe 1 or 2 diagnoses instead of 10, then you can do a few tests instead of doing a whole battery of tests to eradicate 10 or 9 differentials. Now you only have to deal with 2. An AI, you can ask it to suggest the test that is likely to give you the confirmatory diagnosis. That's just one. Tell AI, give me just 1 test that will help me confirm this diagnosis. See? And AI will tell you, bingo, this is it. And when that happens, that usually happens among very, very smart people. You can have physicians who are very smart. They listen to your story and they tell you, wow, this is what it is, without question. And then you don't need to do anything else. But let me tell you, for the majority of the people, they need to do a lot of tests to get to that diagnosis. Now, we're talking about trained physicians using AI. So the time to getting to the diagnosis is very, very rapid. It's without having to do a lot of hunting there in the bush for the diagnosis itself, but because the AI sheds the light to everything. Number 2, the same thing that not just physicians can use that AI, is even clinical health workers, let's say even community health workers out there in the field, can use AI to suggest if you give it a set of symptoms, give the AI a set of symptoms, it's going to suggest to you what is happening in the patient, what test to do, and if any one of those tests is positive, then that's the diagnosis you can confirm. So a clinical provider who is trained, just without having so much training in medicine, let's say a community health worker out there can pick out a lot of diagnoses and manage even to suggest the treatment, because you can ask the AI, now give me a prescription treatment for this type of illness. And when it does that, this does not mean replacing doctors. That means de-skilling the work of doctors. Because you can see doctors training is highly skilled labor, and doctors training will take 6 years, but clinical community, mainly so noisy people, the community health providers or community health workers, now even in a de-skilled work environment like that, they're able to arrive at a diagnosis much faster, and they're much closer to the community, and they are many. So that will eradicate the shortage of doctors. Hold on, let me put my headphones here 1 second. Give me a second, because there's some guys who usually come to run lawn mowers, and I can't even hear myself in this lawn mowers. Okay. Oh man, it's so loud. Can you hear that lawn mower? Sound like a big airplane that's taking out from my outline computer. Okay.
But we can still get you clearly.
Oh, you can get me clearly. It's only me, I can't hear myself.
Yeah.
Okay. So what I'm saying is that when you have now using AI and combined with the diagnosis, then becomes we're now able to cut down the cost of care. Just in France, on the front side before it goes into the health system and people start billing. And then what you have to do is that if you're using the smart contracts for payments, we want to make sure we tie that AI system. That's what's going to be talking about in Nairobi at the summit. We tie that diagnostic system because there's so much data about how to make accurate diagnosis. Just that you have to train a doctor for 6 years, and then you go for residence for another 4 years, and then you go for another training for another 4 years. So it takes a long, long time to get that good, to know how to diagnose like that. But then that knowledge gets distributed, and we want to build it into a smart contract itself, such that the smart contract will be verifying the medical necessity. Medical necessity is the problem, because if you're collecting money from people, then you can have other people taking that money without medical necessity. These are all the providers. They can be billing without medical necessity. And this means the smart contract will only pay for medical necessity. And we have to build that in. It has to be built in the smart contract. And when there's medical necessity, then the claim is going to be approved straight away. And you see, because this whole system is going to be automated, it will not take like the time it takes with the insurance company when you submit a bill, it takes a whole month for them to determine medical necessity. This is something that will be happening within minutes. Why? Because it is on the blockchain. Now they can verify medical necessity within minutes because it's working with AI. That's why now AI and blockchain, artificial intelligence and blockchain is going to be a very, very powerful combination. Yeah, particularly for insurance, verifying medical necessity. I think that's what I wanted to add there, to make sure that people do not misunderstand that we're going to get back into where Blue Cross Blue Shield was in the 1960s, where people were billing any which way they want. And then that problem is still not over, but the US has had to do so much work, create so many regulations. Like now there are about 4,000 regulations in the United States alone, just to prevent that problem I just described to you. To the point that even the federal government, the FBI, is involved in what they call medical what? I need just people looting money from insurance companies, doctors, providers, hospitals, because you could just set up a hospital, or even and then you say you have a lab, and then if anybody comes to your hospital, you send them to that lab before they even see anybody, and then you charge them money for just going through that lab. Yeah. So they now try to encounter, and of course now the regulations are so severe that if they catch you doing just slightly thing, they are going to jail you. First of all, they arrest you, they take away your license, then they tell the press to come in, they take pictures, they run the story in the media and television to discourage people from doing that. But that's because it's a third-party system. Instead of going through all that, management by enforcement, bringing the police into the business, is to create a smart contract that is able to read AI, and then the verification of the necessity, medical necessity itself, is by artificial intelligence, and then that gives the okay that this is a good claim you can pay. Yeah, it's not as medical fraud. Medical fraud is a federal crime today. For example, I know several physicians who have gone to jail. One of them was a pathologist, and he actually went to jail inadvertently. He's a pathologist. What he used to do, when a woman, a lady gives birth to a baby, they have to send that placenta to to the lab, to pathology lab, to check. Then what was happening in the 1980s, 1990s was that well, of course, they learned and they learned how to get ladies discharged from the hospital for maternity. So we have to make a decision at what point to discharge the maternity. Then it came along that you cannot discharge the lady before you get the pathology reports on the placenta. Now, these pathologists, many of them say the placenta is almost always normal. So when they see the placenta, they don't look at them. That's what he was. He wouldn't look at them until he would say he would take them like not medical priority, because, and yet he's still billing for it. He's getting paid, but he has not said, he has not read the placentas. So it means that the hospital could not decide whether to discharge the patient because the placenta report has not come, or whether to keep the patient. But eventually the hospital just discharged the patient because it was assumed from the studies, they can say 95% of the placentas are going to be normal. Okay, it's not going to be, looking at the placenta does not change the course of care. But then what happens? But he still bills. He has not read the placenta, but the patient is discharged. But you see, if he's going to wait for a few days, and the hospital is going to bill at the point of discharge. But the insurance company is going to pay. So the insurance company complained. Complaining means they go to court and tell the judge, tell the court that these guys are not submitting the placentas, they're not the reports, but they're still billing for the placentas. Big deal. Now that's considered medical fraud. Another thing I saw just here in Boston, Massachusetts, is that if you're a doctor, say like you're in the Department of Radiology, and you are working with junior doctors, say you're the consultant doctor, physician. Junior doctors, the technicians take X-rays, and then the X-rays read by, say, seen by, say, the intern, or the residents, or that'd be the registrar, and then the consultant has not seen it. You don't see it because you are busy out there going to earn money somewhere else. Like you went to Mater Hospital instead of being at Kenyatta. So your registrars see the X-ray, and then they say, oh, this patient's got pneumonia. And they say, of course, it's obvious because you are training them. So you know that they are going to be okay. Then they call you on the phone and say, we found pneumonia. Say, okay, go ahead and start treatment. So what's happening? Then they write a report that, okay, the patient was diagnosed with pneumonia because of the finding of X-ray. And then the insurance company gets billed for that X-ray. Insurance company comes and says, who saw that X-ray? Who said that this person has pneumonia by seeing the X-ray? You say, then the doctor so-and-so, the chief or the professor, did he see that X-ray? No, he wasn't there. But we know we are a team. Yeah, of course. Many doctors went to jail for doing that. See, for billing, because what happens, the insurance company is going to pay for the time for that professor, for the resident physicians, for the interns, for everybody. And that's what the insurance is going to claim. It's going to claim we are paying you for the entire package. If you're going to get a diagnosis, then we want to hear that the professor himself or herself has to sign that I saw this image and I agree with this diagnosis. I agree with this finding, or even right there again. So that's what end up to be. That's called establishing medical necessity, because they're saying that there's so many people here who are trying to say this. Was it necessary? Did the professor okay? And why are we paying? So people who are professors, they were cut down and they had to come back and do the same work that the residents are doing because the insurance company have refused to pay. Not just refusing to pay, they are suing and getting them jailed. Because when you go and meet those lawyers, You want to meet the lawyers in the law court, you're not a professor anymore. They are going to fry you. And of course, meanwhile, they destroy your career. So there's a way now to bypass that problem. It's called the third party problem. Third party. And this third party came because, number one, of the way the premiums are collected. People pull money together out of their own pockets. But if we make the system of collecting money to be so imperceptible, it's like where you pay gas fees. Nobody complains about gas fees except when it's very high. And the gas fees is everybody contributing into a pool. And then we make it a way to establish medical necessity using AI, such that only the medically necessary procedures will be paid for. Then we don't have to, and then we can de-scale the process. So the problem of now this third party, where medical practice, before the whole third party came about, medical practice was very collegial. So collegiality in medicine, meaning that if you're a junior doctor and you make a diagnosis, and then you have talked with your second level senior doctor, like a registrar, and you have agreed, that is good enough. And people are collegial. Because I worked in France, that's the way it was. It was very good in France. Because as France is socialized, we don't have all the third party problem. That you can be trusted to make diagnosis, and you don't have insurance company breathing down your neck or even trying to send your professor to jail. Furthermore, taking him to court, shaming him, getting their names in the newspapers, social media, or even on television, the 7 o'clock news. Now that is nonsensical, because what it has done is to make medical practice even more complicated, and people are not even willing to participate in it. But then it is not collegial anymore, with the collegiality of medical practice. And I believe that the collegiality of medical practice will come in. It is going to come back. Perhaps maybe the US is going to take a while, but on the blockchain, where it's going to come back to the blockchain in countries that are not infected by that third party structure. That third party structure is what is being forced upon us in Kenya, because Kenya, we are borrowing the models, the healthcare model from United States. We're not borrowing, it's being forced down our throats, because we actually take money from the World Bank. This is not free money, by the way. Money from IMF. So those people who advise IMF, they are here in Cambridge, Massachusetts. They are the ones who are advising the healthcare system in the United States, but the place is very, very messy. So I believe that the collegiality of medicine is in the blockchain, because you cannot do socialized medicine such as what you have in France, but you can have collegiality of medicine in a non-socialized medical practice, where it's not a socialist, where we are taxing everybody. I mean, there's a whole political drama about the socialism and capitalism. We're not talking about going into socialism. We are talking about accessibility, health access. So one final point is that in this type of collegial practice, where, and of course, de-skilling the practice. Remember, the centralized system, what it has done, without that party insurance system, with all these lawsuits, taking professors to court because they were not there when the X-ray reports came out, when the placenta reports came out, that has made the work very highly skilled. That is super skilling instead of de-skilling. De-skilling means making it easier for people who people don't have to require a lot of years of training just to participate in healthcare delivery. See, it doesn't mean they're going to kill people, okay? Because that is not the objective. It doesn't mean that we de-skill them, we kill people, but we make it possible for people who do not require 10 years of training, they require maybe 3 or 4 years of training, college education, to participate in delivery of care. And those people are in the millions. Otherwise, right now in Africa, we have one physician for 100,000 patients. What is that? We cannot achieve anything with one physician taking care of 100,000 people. But then it's looking among those 100,000 people, some people can do some of the work that physicians do, so that we can do what? We can remove the burden from the shoulders of the physician. That's what's called de-skilling. Like, there's certain things you can do, and we can de-skill very well with AI. Judicious use of AI that is built in a smart contract. So what you're going to do, and of course this morning or this afternoon for you guys, we had a deep conversation with the Web3 consortium community there in Nairobi, and you're going to have these hackathons to hack these smart contracts. The most significant smart contract that we shall hack. We're going to give this hackathon as a competition for all these young techies. Yeah, are you a Gen Z techie or Gen X or Gen Y, whatever gen you are? Get in the hackathon, okay? Create these things. And so I just want to describe to you, first of all, you have understood the power, the effect of it. We're talking about reintroducing the collegiality of medicine by de-skilling medical practice, so that we can actually remove that centralized insurance that is so much concerned about medical fraud, and then they end up banning their own people. How can you train a doctor for 10 years and then you want to put him in jail because of doing what he learned to do in college? That's crazy. But that's where we are. And these people who are doing that, the insurance companies, they don't care. But you will say they're not companies. Those companies are run by people. It's humans being inhuman. Because when you remove such people, if you remove the best doctors from practice so that you can save your insurance money, then eventually you are not going to save your insurance money, you are going to destroy the insurance. And that's zero sums game, that's what it's called. But that's the zero sums game is an artifact of centralized finance system. Okay, so you understand. Now we have announced this. We have announced the hackathons. We're going to be at the summit. So I give Augustine and talk about the summit itself. That's what Gloria said. Okay, back to you, Gloria.
Thank you, Dr. for those comprehensive remarks. I hope now all of us have understood this important topic, the health risk pooling. And in the past few weeks, all of us, we have witnessed, we have seen dark stories on our screens as the transition of NHIF to social health insurance fund happening, that treatment stopped. Many people could not undergo treatment. There are patients who are supposed to undergo dialysis. It was not possible, and people were crying, and it was so sad. And now we have understood what the health risk pooling is capable of doing. I mean, the decentralized, like, health insurance, fund. So here we have at Actuate, we recognize that, and that's why we have come up with this innovative solution. We want few months or years to come to put an end to that. So as Dr. has said, we will have a series of hackathons for health access, but I will hand over this to Augustine to give us in the announcement of the summit. Augustine, if you can hear me.
Hello everyone. Good evening. I hope we are all doing fine. So, and thank you so much, Anthony, for that topic. It's an interesting topic. I think the Actuate health risk pooling smart contract. It was an amazing that was an amazing presentation and a very significant area. We are really keen to actualize, because we are in crisis currently in Kenya. So as we all know, again, we have our summit, the Actuate Pre-Boston Nairobi Summit, and it's 2 months to it, from 3rd to 6th December, and it's all about how we can create a bright, healthier, and more equitable future. When we look at it very well, it's all about health equity. We are really minding, we are really mindful of economics of the patient. You know, all other things at the end of the day, money talks, yeah. So that is the discussion we are having in this summit. How we can use AI and blockchain technology to create a future which is more brighter, more healthier, and more equitable. And when you look at common components, the main component of health inequity is economics of the patient, affordability of healthcare. That is the ultimate thing we need to look at. When someone is able to pay for healthcare services, then he or she can access quality healthcare, and therefore that improves the overall well-being and also accessibility of this healthcare in terms of efficiency and yeah. So that is the discussion, and I love this. As Doka said, we just had a discovery call with Web3 guys, and we agreed that we're going to have a series of hackathons, smart contracts hackathons for various as areas, key areas when it comes to health access, health risk pooling, promoting, incentifying, rewarding health promoters, rewarding health providers, and even talking about public health and epidemiological data tracking, and also drug management, the prescription drug management. So as you can see, that is where we are moving. That is our goal. That is what we are focusing on, and we are reaching out to various stakeholders to actualize this, because this exercise is not, we cannot just sit here and say that we can actualize this. First, there is a challenge of resistance because of obviously onboarding a new technology is hard. And this summit is aiming to bring together, that's why we are talking about a multidisciplinary event. You know, health providers need to understand this. Health promoters need to understand this. Consumers of health needs to understand this. The authorities, the government agencies, and even the top leadership needs to understand this, so that as a whole, the entire house will be ready to onboard this. So that is where we are focusing, and this is a groundbreaking summit. It's a multidisciplinary, and it's all about creating the future we truly want. So today I will just love to, I'm just excited about the topic, today's topic, and I would love to say that this summit is making sure that we have an output, an outcome at the end of it. To actualize this, we must have roadmaps. We must have collaborations and partnerships to do this, because we are currently in crisis. All right. So again, poster presentation is there for you. We are giving priority to students, those in healthcare, those in agriculture, those in water, those in computer, ICT, those in um, mm, just other areas. You know, when you visit our website, you see the criteria, how you can match the three technologies to come up with something, a healthcare solution, or a solution that can improve healthcare and human development. So the poster presentation is there. Come with your research, prepare a good poster, and the benefits are there, including apart from networking, other things like being part of the community and uh, receiving benefits like a ticket to the mega summit, whereby now we feel like that is the bigger thing we are waiting. We're just right now we're just paving the way to that summit. So it's a good thing for you to be there, do your poster presentation, so that next year you can able to scale, go high, meet big people during the next summit. And immediately after this summit, tickets are gonna start selling for the next summit. And if you do a good poster presentation, we're not gonna sell you the ticket. We're going to give you the ticket, all right? So so that is it. And also exhibition is there. Come with your service, come with your innovation, look for accelerators around you, look for support around you, let them finance you. All right. We are not saying that, you know what, we understand that anything with value, all right, anything with value must is always rewarded. It's possible. So pitch your ideas to people around you, let them finance you to this summit, so that now you can come and meet more um, the industry leaders who can now either help you roll it out, or connect you to other people, venture capitalists. And also now we can also see, because we are funders. Actually, itself is just funding body, right? So do something, move an extra step ahead, and even the Almighty God can reward you. Don't just sit, all right? Yeah. As I always emphasize, don't fade, don't tire, try your best. Opportunities are always there. It's all about identification, your ability to realize opportunities. All right. And success requires a success strategy. All right. So, do you have a success strategy? Are you seeing an opportunity around the summit? Let us know. Let's extend this conversation to our Facebook page, Twitter page, LinkedIn, our WhatsApp group. Let's share this. All right. And we have various partnerships going on, over 5, 6 groups, WhatsApp groups. They are bringing their people. KUTRH is bringing their people, both workers and even students. Over close to 200 from KUTRH students. All right. So what is limiting you from being part of this? All right. So that's how we build the future we want. It's me and you. So don't just wait. Right. Try. And I'm so much optimistic to meet with all of you, okay, during the summit as we build this future we truly want. We cannot do it ourselves. We need you. I need you. You need us to actualize this. All right. Yeah, it's not an easy thing. It's totally innovation. It's totally new thing. So we need all hands together. All right. Yes. So thank you so much, and looking forward to linking up with each one of you. Thank you.
Thank you, Augustine. Sorry. Thank you, Augustine, for the summit announcement. Yeah, as you've all heard, we have, as you've heard from Augustine, we have an upcoming summit at Kenyatta University from 3rd to 6th of December this year. And one of the things, and Augustine has talked about it comprehensively. And we also do talk about it every time. And I think by now we all understand what is expected of us, how we can participate, and for sure it's a golden opportunity. We also rolled out the series of health access hackathons, as you've heard from Augustine. We have the first one, which is health promoters reward system. We have also health providers reward system, health risk pooling, public health data for epidemiologic data tracking, and prescription drug management. So we call upon all of us, not those interested in this hackathon, in building the smart contracts for each. The 5 that I have mentioned. So those who are interested can reach out, and maybe this is your opportunity. I read somewhere that we should be uncomfortable. You should always feel restless until you do something that will bring change to humanity. And every time I ask myself, what is this one thing that I am doing to bring change to humanity, to humankind, sorry. And I feel that this is one of the things, maybe for one of you. Yeah, so let's try. So we are almost coming to the end of the meeting. So if you have any concern, if you have any question, even concerning the competition, the hackathon competition, the floor is yours. You can ask, or Doctor, maybe if you have any other comment before we conclude the meeting. And also another concern to Frida, the chat box, it's disabled. Maybe you can do something about that, Frida, please.
Okay. Let me see. Am I audible? Can you hear me, Gloria?
Yes, yes, Doctor, you can hear.
Okay. Yeah. Strategy for success. That's the thing. Strategy for success. Of course, you need to have a strategy for life. And what Frida says, was Glory. Glory and Frida are getting confused in my head. I'm confusing my lionesses. Who said that? You got your lions mixed up. That was in Lion King, of course. Don't get your lions mixed up. All right. Well, so Glory. Strategy for success. What do you think? Do not rest until you create that change that you would like to be for humanity, for mankind. But before you can create that change, you have to be that change yourself. Can you believe that? You have to be that change yourself. You have to be the change you want to create. You have to be the change you want to see. That's even what Mahatma Gandhi said. But even before Mahatma Gandhi said that, Jesus Christ himself had said that, using other words. Be the change you want to see. Be the change you want to see. If you want there to be health access, be the health access. Be the one who's providing that health access. Be the one doing it. And then health access will manifest. That means that is known as the principle of love. That if you love what you're doing, you're not going to work a day in your life. Somebody else has said that. But of course, Jesus Christ is the one who's called love. That you have to love what you're doing, like the way the moth loves the flame. Who knows about the moth and the flame? The moth loves the flame so much, it enters the flames and gets consumed by it. You know the moth, that's butterfly-like thing that likes to fly in darkness and then get activated by light. The way the moth is attracted by light, gets close to light, but then if the light is a flame, it will go inside the flame and then gets consumed by it. So unless this thing consumes you, then change will never happen. So, and to emphasize this, we are doing these hackathons, and don't think they are for somebody else. This hackathon is for you. Don't say, I do not know how to code, because you are not going to survive in this 21st century without knowing how to code. That one I can guarantee for you. Now, if you want to advance your career, you better know how to code the way you know how to do your ABCs, the alphabet. When you went to school, in primary school, nursery school, they started teaching you the numbers, the numerals, numbers from 0 to 10, and then you knew how to count with numbers. Then besides that, they taught you the alphabet, A, B, C, D, and they taught you the vowels and the consonants. And then you have learned all those good things. That was then. Now, the state of development, let's say the global revolution, has it that those numbers you learned were very, very good, and you have done a lot with them. The text you learned by writing alphabet was very, very good, and you have done a lot with them. Now you can write novels, you can write dissertations, you can write whatever in text. But now what you want to know is how to use that text to write code, instructions, to give computer instructions of things to do. And that is right there for you. Unlike the olden days where the knowledge about how to do these things was not there, this knowledge is present. It is right there on your cell phone. You can learn how to code in your cell phone. Participate in hackathons, get involved, because truly, truly, I say to you, I say unto you, we are not going back. You know how to code, you need to know how to write smart contracts. You want this work to be of any value to you, what we have covered this whole year. You want to know how to do these things, because the next cycle, you're going to see is going to have serious hotshots. You see, all these things in the past centuries have been confined to privileged populations. People in Europe, their children, they learn how to code when they are very young. Like, for example, if you go to Netherlands or Norway, young children are learning to code there. So it's other European countries. But in Japan, they start in elementary school. Japan, they're not just learning alphabet, the Japanese alphabet. They're also learning how to code HTML, C++ for their elementary school kids. Because they want those kids, by the time they're coming to a certain age 10, they can begin designing robots. That's why this idea of robotics and all that. And when they are doing that, what are we doing in Africa? Thinking that this is something for somebody else. Because I have worked with those people, the Japanese, the Europeans, particularly from people from Sweden, Netherlands, who are very good, big in computer science, and the South Koreans, they are not much any more brilliant than any other average human being. The only thing they do, they spend a lot of time learning the things these of value they're going to use today. They don't spend a lot of time learning nonsensical stuff, even talking politics. Okay, so instead of spending time watching TV, watching what drama, or even booting up your laptop to watch movies on YouTube, boot up the movies that are teaching you how to code. And this knowledge today is available. You don't have to buy it. All you need to have is bundles. Okay, and then you would participate. Now, and I expect that if you have done all this work to even produce this summit, you must be there. I expect you to be there because that's the strategy for success. Remember, it is written that for those who have, even more is given and they have abundance. You will not expect abundance by saying you don't have even the money to come there. Yeah, do everything you can to make sure you are there at the summit. Do not expect anything for free. Now that is, yeah, if you're expecting this for free, now you're not going to be, you're like that one who was given talents and then they buried it under the soil. And you remember those who do not have, even the little they think they have is taken away and they have nothing. Okay? Those who do not have, that means if you say you don't have money to participate, even the little money you think you have, it will be taken away and you have nothing. I am not the one who said that. Ask Matthew. Matthew in the New Testament, he says that, quoting Jesus himself. Those who do not have, even the little they think they have is taken away and they have nothing. That is that's a universal law of nature. It's like a law of gravity. Just like you cannot say there's no gravity and then you see you're not going to fall because you don't think there's gravity. It's not up to you to think. If you think you do not have, even the little you think you have, you will not have it anymore. And I'm telling you, this thing is a matter of fact. That's what's called the truth. You know the truth, and the truth will make you free. Why is it that the opposite, those who have, will have more, will be given more, and they'll have abundance? Because you cannot get anything unless you give. That is, called the law of retribution. That if you give, it comes back to you. And what I'm talking about giving is that give yourself time to learn how to create these smart contracts. You give, that's called investing. Invest time, okay? Get to know how to do things. And then when you get to know how to do things, you get to know how to do things. That can never be taken away. And the more you know, the more you know. And then you have abundance. But don't strive to get to know useless stuff. Things like politics and politicking, or gossip, or getting involved in idle talk. That is what consumes a lot of time. That's called spending. You'll be spending time. Some people call it killing time. You can never kill time. You can never kill time. You can only kill yourself, but you can't kill the time. Time is alive and it's continuously moving. So do not engage in activities that will kill time. You know, as people say, do not engage in activities that are going to spend time. Don't spend time. Invest time. Because when you invest, that means that you're doing something that is adding value to your career. And ultimately, coming to the summit and even presenting there, it's a very huge networking opportunity. Because all these talks we've had here and talking to a lot of people, very many people, professionals excited, and we continue to invite more people. For example, earlier this week, Augustine and Glory and who else? And Lillian. Yeah, it was Dolphin. They were at the University of Nairobi and they met some supremely serious people in computer science and medicine. They were talking about health tech and what AI, artificial intelligence. Very big meeting. They had very serious, wonderful presentation. All those people, first of all, it creates when you attend such meetings, you get opportunity to interact with, you call the heavyweights in all industries. They're not in one country, and they actually people doing real large projects in the world. You want to get to know such people, and those people will be either represented at the summit in or they are going to be there in person. Or if they're not there in person, they are going to be online. So it becomes a place where you network with such people. It's really serious, building your career. And remember, all the other people who have agreed to come, you put that group in the University of Nairobi, in the computer science lab, and Kenyatta University, TRH. So many companies have agreed to come in, including having conversation with a cell phone manufacturer, smartphone, so that we can go into partnerships. Now we are talking about creating high-profile partnerships for health access. So the conversation is very, very deep and profound. And you do not want to miss any of that. Now, if you missed it, do not say, I did not tell you. Now, you can miss and saying, I don't have money. Now, listen to yourself saying such a thing. You have money. If you don't have money, go and find it. Okay? Yeah, go find the money. Why? Because it is there. There's a lot of people who want to support you, and you can ask them to, because eventually you need money for anything. Even where you are right now, you need cash. So let's figure out how to do this. That the Actuate Foundation can only do so much to support you and support people, but then people also have to support themselves so that we know that we are doing this together. We're doing this together. Yeah, and then we have Actuate tokens. I think one big thing you can do to make it very meaningful is people in your network, is to help them buy Actuate tokens. And if you want to do that, now that's going to create a lot of liquidity for Actuate tokens. But if you don't know how, yeah, of course, because you've been with us for the longest time, get people to buy Actuate tokens through liquidity pools, through swapping. And the more people swap the tokens, the more liquid they get. And maybe if you do that very well, you become an evangelist for Actuate token. Evangelist means a preacher man or preacher woman. You're going there in the communities preaching about Actuate token, mobilizing people like nobody's business. Now that's a job. Because the more people you mobilize, the more Actuate tokens you earn, because that is rewarded with tokens. But you have to mobilize the people. You have to mobilize the people, and you're mobilizing people for two reasons. One, to buy the Actuate tokens themselves. Number two, to come to the summit. Number three, to create liquidity pools. So it is very, very important you do that. Do not be the one who's sitting back there and waiting for things to happen to you. Nothing will happen to you, because for those who do not have, again, I want to reemphasize this, even the little they think they have is taken away and they have nothing. That is a divine law. So, but if you have, you go there and mobilize people. Like what stunned me is KUTRH. I just want conversation, and suddenly KUTRH has mobilized about 200 people within a week or so. Now you have the ability to do that. And then, of course, as an ambassador, so operate as an evangelist for Actuate Token. I think now you have learned enough to know what Actuate is talking about. Actuate Token is all about. We want you to mobilize people as the evangelist. Now, if you want to be listed as an evangelist, now you can contact Glory here and any other member of this team of Actuate Nation, talk to Frida, say, I want to be evangelist of Actuate Nation. And then that message is going to reach to me, and by my authority, an authority given to me by the Actuate Nation, I will declare you the evangelist of the Actuate Nation. How about that? And then that was the evangelist of Actuate Nation. You get to earn even more actuates by evangelizing. Yeah, that's it. And then you can mobilize as many people as you can in this planet, because this planet has got about 7 of those people. Billion, 7 billion. Okay, so that's it, Glory. So here we are recruiting evangelists. That's what I think that's the message. That's the message for evangelists here.
Thank you, Daktari. So you've heard that Daktari is recruiting, we're recruiting an evangelist.
Many evangelists.
So,
Evangelists.
sorry?
Many, not one.
Sorry?
Many evangelists.
Yeah, many evangelists for evangelist for Actuate Nation, Actuate Tokens. So
Yes.
if you are interested, kindly reach out. It's a great opportunity. So thank you, Daktari, once again for your time and for sharing with us your precious knowledge and always having people's needs at heart and always bringing change. And thank you to our topic master Ronald for that powerful presentation. And thank you everyone for joining. So we will be having such sessions every Thursday from 8 to 9 until we get to our summit. Let's continue evangelizing the good news of Actuate. Let's spread the news to everyone and let's bring more people on board. So Frida, I am unable to send the attendance form because the chat feature is disabled. Hello. Hi, Frida. Hi, Frida. So unless there's any other concern, we can conclude the meeting. Daktari, thank you for your time. I will see how I can send the Google form. The meeting is adjourned. Yeah, so those that have attended the session, kindly DM. You can inbox me. I send you the attendance form. Bye bye. Yeah, we can leave the meeting and then I will send you the attendance form at your DMs. Kindly DM